Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study published in the Journal of Veterinary Internal Medicine in 2024, which investigated the evaluation of muscle mass and intramuscular fatty infiltration in dogs with hypercortisolism and their association with prognosis. Hypercortisolism, a condition where the body produces excessive cortisol, can lead to various health issues in dogs. This research specifically focused on quantifying muscle atrophy and the presence of fat within the muscles of dogs suffering from this endocrine disorder, and how these factors might relate to their survival. In dogs with hypercortisolism, also known as Cushing's syndrome, an excess of the hormone cortisol causes metabolic disturbances throughout the body, often resulting in noticeable clinical signs, one of which is muscle weakness. In humans with hypercortisolism, it has been observed that muscle atrophy, a decrease in muscle mass and intramuscular fatty infiltration, the accumulation of fat within muscle tissue, are associated with the elevated cortisol levels and contribute to muscle weakness. Beyond their role in movement, skeletal muscles are crucial for energy expenditure and maintaining the balance of glucose, lipids, and amino acids. They also play a part in inflammatory and immune responses, all of which can influence a patient's overall prognosis, especially when combined with other health conditions. Studies in humans with conditions like cancer, chronic heart disease, and chronic kidney disease have shown that muscle atrophy is linked to shorter survival times. Similarly, the presence of fat within muscles can negatively impact quality of life and potentially affect both survival time and the degree of muscle atrophy. Given these observations in humans, researchers hypothesized that muscle mass and intramuscular fatty infiltration might also be associated with a poorer prognosis in dogs with hypercortisolism. Hypercortisolism is a frequently diagnosed endocrine disease in dogs. Muscle atrophy is a common finding, affecting approximately 30% to 50% of dogs with naturally occurring hypercortisolism. This muscle wasting can lead to exercise intolerance and difficulties with movement, significantly impacting a dog's quality of life. Previous research in dogs with hypercortisolism has suggested that muscle weakness or a low body condition score, which are thought to be consequences of muscle atrophy, were associated with a worse prognosis. However, these prior evaluations of muscle atrophy were largely subjective, and there was a lack of quantitative measurement of muscle mass. Furthermore, it was not clear whether intramuscular fatty infiltration occurred in dogs with hypercortisolism. Therefore, the study aimed to quantitatively evaluate muscle atrophy and intramuscular fatty infiltration in dogs with spontaneous hypercortisolism using computed tomography scans. The second objective was to determine if these muscle changes were associated with survival time and could serve as indicators of a poor prognosis. The study involved a retrospective analysis of medical records and computed tomography images of 53 dogs diagnosed with spontaneous hypercortisolism and 66 control dogs without the condition, all of whom were between 8 and 14 years of age. The diagnosis of hypercortisolism was based on a combination of clinical signs such as increased appetite and thirst, increased urination, panting, abdominal enlargement, hair loss, and increased liver size, along with laboratory test results and endocrine function tests. Computed tomography scans were recommended for dogs with hypercortisolism and performed at the owner's request. To ensure the muscle assessment was not affected by other factors, dogs treated with corticosteroids or those who had undergone surgery that could affect muscle mass within the past year were excluded. The control group consisted of dogs without hypercortisolism who underwent computed tomography scans for other reasons and had no clinical signs of hypercortisolism or adrenal enlargement. Dogs with other diseases known to affect muscle mass were excluded from the control group to ensure a valid comparison. To evaluate muscle mass, computed tomography images of the paraspinal muscles at the level of the third lumbar vertebra were analyzed. Two methods were used to define the region of interest for muscle measurement, considering the potential influence of fat infiltration. First, the muscle regions were visually assessed to determine the cross-sectional area, referred to as the visual cross-sectional area. Second, the cross-sectional area was automatically calculated based on a predefined range of muscle attenuation values in Hounsfield units, a measure of tissue density obtained from the computed tomography scan. This was termed the Hounsfield units-based cross-sectional area. To account for differences in body size among various dog breeds, these measurements were adjusted by the length of the fourth lumbar vertebra. Additionally, the Hounsfield unit values of the epaxial muscles at the same level were recorded as a quantitative measure of muscle attenuation, referred to as L3HU. The survival analysis focused on dogs with pituitary-dependent hypercortisolism who were treated with trilostane, a medication commonly used for this condition. Dogs treated with other medications for hypercortisolism or those who did not receive treatment were excluded from the survival analysis to ensure consistency. Survival time and cause of death information were obtained from medical records or by contacting referring veterinarians. The results of the study showed that dogs with hypercortisolism had significantly lower visual cross-sectional area and Hounsfield units-based cross-sectional area compared to the control dogs. This indicates a reduction in muscle mass in dogs with hypercortisolism. Furthermore, the hypercortisolism group exhibited significantly lower Hounsfield unit values in their apaxial muscles at the third lumbar vertebra than the control group, suggesting the presence of intramuscular fatty infiltration. Statistical analysis showed that the presence of other health issues did not significantly influence the measured muscle parameters in dogs with hypercortisolism, suggesting that the observed muscle atrophy and fatty infiltration were primarily associated with the hypercortisolemia. In the survival analysis of dogs with pituitary-dependent hypercortisolism treated with trilostane, the researchers found that dogs with lower Hounsfield units-based cross-sectional area or lower Hounsfield unit values of muscle at the third lumbar vertebra had significantly shorter survival times. While dogs with lower visual cross-sectional area also tended to have shorter survival times, this difference was not statistically significant. The findings of the study provide quantitative evidence that dogs with naturally occurring hypercortisolism experience both muscle atrophy and intramuscular fatty infiltration. The lower muscle mass observed in the hypercortisolism group aligns with findings in humans with the same condition, where excessive cortisol is known to suppress muscle protein synthesis and promote muscle protein breakdown. While other factors can contribute to muscle atrophy, the study's careful design, including the use of an age-matched control group and the exclusion of dogs with recent corticosteroid use, along with the statistical analysis that found no significant effect of comorbidities on muscle mass in the hypercortisolism group, strongly suggests that hypercortisolemia is the primary driver of muscle atrophy in these dogs. The mechanisms by which glucocorticoids induce muscle atrophy in other species, such as the activation of protein degradation pathways and the suppression of protein synthesis pathways, are likely to be similar in dogs, although further research is needed to confirm this. The observation of lower Hounsfield unit values in the muscles of dogs with hypercortisolism indicates the presence of intramuscular fatty infiltration. Computed tomography imaging is a valuable tool for assessing fat infiltration within muscle tissue because fat has a lower density and thus a lower Hounsfield unit value compared to muscle. While other factors can influence muscle attenuation on computed tomography scans, the significantly lower values in the hypercortisolism group strongly suggest fat accumulation within the muscle. The precise mechanisms behind intramuscular fatty infiltration in hypercortisolism are still unclear, but it has been hypothesized that cortisol might promote the differentiation of stem cells within the muscle into fat cells. Intramuscular fat can disrupt muscle structure and metabolism, potentially impairing muscle function. Given the known clinical relevance of intramuscular fatty infiltration in affecting quality of life and prognosis in humans, it is plausible that it holds similar significance in dogs. The researchers utilized the apaxial muscles, located along the back, at the level of the third lumbar vertebra for their measurements. These muscles are considered less susceptible to changes due to posture and have been shown to reflect overall muscle quantity. Their use in this study, demonstrating significant differences between dogs with and without hypercortisolism, supports their suitability for assessing muscle changes in this condition. Two methods, visual cross-sectional area and Hounsfield units-based cross-sectional area, were employed to evaluate muscle mass. Each method has its own advantages and limitations. Visual assessment relies on anatomical recognition but can be subjective, especially in cases with fat infiltration where distinguishing muscle from fat can be challenging. Hounsfield units-based assessment is more reproducible as it uses standardized tissue density values, but might underestimate muscle mass in cases of fat infiltration where the overall density of the muscle is reduced. The fact that both methods showed lower muscle mass in dogs with hypercortisolism strengthens the evidence for muscle atrophy in this group. The finding that dogs with more severe muscle atrophy, as indicated by lower Hounsfield units-based cross-sectional area and greater intramuscular fatty infiltration, reflected by lower Hounsfield unit values of muscle, had shorter survival time suggests that these muscle changes can serve as indicators of a poorer prognosis in dogs with hypercortisolism. In human medicine, muscle atrophy and weakness, collectively known as sarcopenia, are associated with adverse health outcomes. Skeletal muscle plays vital roles beyond movement, including nutrient storage and metabolic regulation. The metabolic disturbances and muscle wasting seen in conditions like hypercortisolism can lead to a cascade of negative effects, potentially including decreased exercise capacity, impaired cardiopulmonary function, reduced immunity, insulin resistance, malnutrition, and worsening of existing health problems. The shorter survival observed in dogs with significant muscle atrophy or fat infiltration might reflect the impact of these detrimental effects on their overall health and ability to cope with hypercortisolism. It is also possible that the severity of muscle atrophy and fat infiltration is linked to the severity and duration of hypercortisolism itself, with more pronounced muscle changes indicating a more severe and chronic condition, which in turn could contribute to a poorer prognosis. The study acknowledges certain limitations. The inclusion of dogs with hypercortisolism was based on the availability of computed tomography scans, which might have introduced a selection bias towards dogs with more severe or unusual presentations of the disease. The relatively small number of dogs in the survival analysis also limits the ability to definitively rule out the influence of other confounding factors or to evaluate the effects of specific coexisting diseases. Furthermore, the cause of death was not confirmed by necropsy in all cases, meaning that the reasons for shorter survival might not have been solely attributable to hypercortisolism or the observed muscle changes. However, previous studies have suggested that some of the common comorbidities observed in dogs with hypercortisolism do not necessarily affect their survival. In conclusion, this research provides valuable quantitative evidence for the presence of muscle atrophy and intramuscular fatty infiltration in dogs with hypercortisolism, as assessed by computed tomography imaging. Importantly, the study demonstrates that the severity of muscle atrophy and the extent of intramuscular fatty infiltration at the time of diagnosis are associated with shorter survival times in these dogs, suggesting that these muscle parameters have the potential to serve as negative prognostic markers. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.